Thrombophlebitis. Thrombophlebitis is a local, non-infectious inflammation of the vein wall associated with thrombus buildup in the vein lumen. The main symptoms are pain, redness, edema, tenderness, and warmth. It is a very common cardiovascular complication that develops in postoperative patients and can extend a patient's length of stay and overall cost of hospitalization. Short peripheral catheters are most commonly used intravenous device in today's medical practice. Typically, an SPC is inserted into a peripheral vein, such as the back of the hand or crease of the elbow, and are used to administer IV drugs, fluids, and nutrition. SPCT is a thrombophlebitis caused by these SPCs and occurs in up to 80% of all hospitalized patients and usually shows up about 3 days after the catheter is inserted. The article I found by Weiss et al. Was a discussion of their new catheter design aimed to reduce rates of SPCT. To test their design, they inserted prototypes into pigs' ears and then measured the SPCT development rate via MRI 4 and 12 days after catheterization. Their design was to use very short peripheral catheters and, as a result, just shortened the overall length of the device inserted into the vein. The results of their study showed that the very short peripheral catheters did not require any special skills for use, meaning it doesn't require any additional training. And the results also showed that in comparison with traditional SPCs, their VSPCs did not come in contact with the vein walls, which allowed for better blood perfusion and, as a result, lowered the SPCT rates overall. The study has opened many doors for future studies since this was a new procedure and was only conducted in pigs. The authors of the study themselves realized that this study is not the solution to human SPC, mostly because pigs and humans have similar but not identical cardiovascular physiology. They also mentioned that there is a potential for expanding this research to involve deeper veins to see if there are any other therapeutic solutions within reach. The reason I chose this article was because of its age and truthfully because the title caught my eye. Published in 2019, this truly is a novel treatment that has the potential to drastically improve many hospitalized patients' outcome by avoiding the development of SPCT. This article relates to the course readings because it's an active study aiming to reduce the prevalence of thrombophlebitis, which is a huge potential cardiovascular risk in post-surgical patients. Also, I'm beginning to realize my fascination of the human cardiovascular system, and I'm finding keen interest in this subject. This article helped me learn more about complications and potential treatments. For this presentation, I used the article by Weiss et al. Published in 2019 in the journal Thrombosis and Hemostasis and our Fundamentals of Nursing textbook by Taylor, Lynn, and Bartlett.